Okay. Actually, 25 years ago, I gave the first presentation using testosterone in men to control diabetes. And at the present time, the director of the United Kingdom Diabetes and Endocrinology published a paper in October of 2023. It picked up in May in Medscape that he's using testosterone to treat 500 diabetics with an average drop of hemoglobin A1C of almost 3 points.
Hmm.
That's a 50% reduction in cardiovascular disease. But my for 25 years since 1999, and my data showed dropping A1C actually from as much as 16. So the program I have with three anabolic steroids, we're even better than the program in England and Europe. All right, the second thing you asked about is endometriosis. I've just completed publishing a paper at the American College of OBGYN showing the cause of endometriosis. What happens working with Manuela Newman, who's director of the in vitro pro-inflammatory cytokines group at the Banning and Best Center in Toronto, we've identified the steps of how the environmental toxins cause endometriosis and how to turn it off. Presently, approximately 50% of women still have pain after laser surgery.
Yep.
This, the study I did was with the top laser surgeon, Dr. Pasek out of Louisville. And what we did is we drew blood from the patients before he operated on them. What we were looking for is inflammatory cytokines. This is
Mhm.
how the lymphocyte goes ahead and puts up a fuss. The way I describe the cell is almost like the description in the Bible. You've got normal cells, that's Adam and Eve, then they're affected by eating inflammatory apple and eventually goes on to become our diseased environment. Now, there's been work with Dr. Perimucci in Crohn's disease out of director at Rome. Basically, the three boxes are like this. If you're normal, you have normal levels of anabolic steroids,
Yes.
testosterone, nandrolone, stanozolol, and danazol. But you also have a lower level of what's called sex hormone binding globulin.
Yep. Like with
So women's
PCOS, like
so
PCOS
women
picture.
sex hormone binding globulin gets increased by environmental toxins, and that ties up the good testosterones,
Yep.
nandrolone. Okay, so the bottom line is first can draw blood work, and the ratio is supposed to be zero point 0.3 testosterone over, we'll say, 1 of SHBG. And if it's not, then she will have lack of anabolic steroids. What was identified by Dr. Perimucci in Crohn's disease is that there's a estrogen receptor beta that sits on the DNA membrane. And Bulin had already shown that endometriosis was associated with high levels of estrogen receptor beta.
Really,
So
not
we
not not alpha involved in that at all. Much.
so what happens is we drew the blood work on these patients and found the ones that had excessive endometriosis had high levels of estrogen receptor beta,
Wow.
and those who didn't have endometriosis didn't have elevated. So we already established now that there's a marker on the membrane for endometriosis and high estrogen receptor beta. Now, in the case report I published in 2014, probably presented at the Forum 3020. Severe endometriosis so bad she was on a morphine drip at Johns Hopkins. But
Oh,
when we identified the right anabolic steroids, she's now been pain-free for almost 20 years. So we have a technique where we look at your inflammation. And if you have endometriosis and you have inflammation, the third step is you want to identify which drugs, which pharmaceutical, which natural products can reduce inflammation.
mhm.
So in the lab, we're able to go ahead and add samples of drugs. I told you Danagrin, whatever, and then reprocess the inflammatory markers. It's like saying 100 years ago, we have a culture plate of inflammatory markers. What drugs will get rid of it? So we did that back in 2014 and identified that this patient, that two of the three anabolic steroids would suppress the inflammatory markers. So now what we have is we know there's a marker, commander in chief called the estrogen receptor beta. It's been identified as being elevated in women with endometriosis. We confirmed that in a study with Dr. Pasek. And then what we've done with the one case and others since that is we've added anabolic steroids, depending on which ones in culture show to be able to suppress inflammation. And we have results that are over 90% compared to the standard 50%. So by going to the science inside the cell, we can identify that there is a missing group of anabolic steroids in endometriosis. And we don't use testosterone, we don't use estrogen, we don't use Lupron, we don't use the progesterone IUD, and our results are excellent. And the video of that patient is in my section. Now identify a cause and effect, precursors, and results. I think that covers it pretty well.
Yeah, pretty well. William Crook wrote about endometriosis being caused by Candida. Is there any kind of fungal interaction here that would push you to more estrogen receptors beta? Does that create that condition or no?
Estrogen receptor beta depends on anabolic steroids to be able to function properly. Whatever sets it off, I just said environmental toxins. If you go ahead and you want to treat with yeast products, that's fine, but you need the anabolic element. See, everything in disease really is gender, okay? And we're very, very deficient in anabolic steroids. It's been picked up since the 1980s in almost every autoimmune disease.
Yes.
And top university people around the country have said that. But I clarify by saying, here is a marker, and we measured the markers and saw that they were higher in the women who had more active endometriosis. So
Is this
active endometriosis, active alpha receptor beta, and more inflammation. And when you replace the appropriate anabolic steroid, it turns down the estrogen receptor beta and the inflammation. So inflammation, estrogen receptor beta are locked hand in hand. We have now like cause in a direct target area.
Are there any labs that offer testing for estrogen receptor beta? Or is it just
Yes,
clinical? There's so you can get it done
I have a
clinically?
special lab in Toronto,
Oh, you
but
do?
that's who runs the estrogen receptor beta. But you can get interleukin 6,
Okay,
interleukin
inflammatory
1,
marker. Yeah.
and TNF alpha from LabCorp at a cost of, maybe $1,500. We would like to see that less, but on the other hand, we have a clinical proof that the treatment works.
Very nice.
That's that's 60 years of research.
In 10 minutes.
Hmm?
In 10 minutes. That's really important. So you don't use testosterone, you use some of the synthetic
No,
anabolic
some of
products.
the derivatives never use a synthetic.
Okay, so what are they? Which do you use?
Nandrolone is the first derivative of testosterone.
Okay.
Nandrolone.
And I remember when that was only available from Europe. Can we get it now? Nandrolone
It's through compounding.
compounding. Okay.
Compounding pharmacies have nandrolone.
Okay.
The
And
second one is stanozolol,
okay.
which was called Winstrol
Yeah.
compound.
And that's
Third one is,
also a derivative of testosterone itself.
yeah, I believe it's a derivative of dihydrotestosterone.
Okay. Okay.
The testosterone goes to nandrolone, and dihydrotestosterone goes to danazol and stanozolol. I prefer the stanozolol
Okay.
because it's injectable. So we can make up one syringe with the two medicines in it, and lo and behold, it works.
Okay. So if one had a serious case of endometriosis, how often would they need to be supporting the androgens? Would be daily, weekly, monthly?
And usually I have results within 2 to 4 weeks.
Mhm.
That patient has been on the medication almost 20 years now, 15 years at least. And she never sees me. She just calls and gets a refill and sends in blood work.
Okay. So how often do you do the injection?
Patient does the injection once or twice a week, depending on how severe her disease is. In this case, she was doing it twice a week, and most women once a week. And a
Okay.
little spironolactone keeps the little peach hairs off the chin.
Does it really? That's a big problem with menopause.
Right, but here, no pain
No.
with intercourse, and no menstrual period. Shrink fibroids, ovarian cysts, breast cysts. Very interesting way, what we're doing is using the nandrolone, stanozolol, danazol to block the estrogen receptor alpha, which is where you get the breast cancer and the
Mhm.
bleeding and the cysts. So we're actually therapeutically, I don't want to say substituting male for female, but you're blocking the female receptor. So there's nothing feeding the body to make estrogen substances.
So what about using people using estriol, which favors the estrogen receptor beta? What would
Well,
that do to endometriosis? That would be maybe contraindicated
I
or not.
wouldn't use estrogen at all. The
Yeah.
nandrolone is the most potent blocker of the estrogen receptor alpha, and therefore the strongest support for estrogen receptor beta. And I've been doing this since the 80s, and results have been consistent
This is really fabulous. There's very little in the literature about shrinking fibroids.
in the process, and I can stand back behind.
There's very
I
little
can,
in the literature that I've come across for something that shrinks fibroids.
right, but there's a video I have on my website as well. You got to look for a little bit, but I shrunk 16-week fibroids down to nothing over a period of years. But as long as they're not bleeding, it's
Yeah,
no
who
issue.
cares? Yeah, that's true.
No, we actually have just started one case I followed for a matter of 3 years with a woman with breast cancer, triple negative, who was inflammatory
Mhm.
on the blood test. And we were able to, using a topical cream, suppress that inflammation for 3 years, and she felt well. While another patient, we couldn't find a drug to suppress her, and she died. So there's some work with estrogen receptors with breast cancer and treating the inflammation topically, which I think is wonderful, and we should be pursuing that. Again, the product of cream is not that expensive.
No.
The cream can be found on my website, which is usdoctor.usdoctor.info. And the phone number there is not active at this time, but we can put it up on the screen. So endometriosis to me, I consider a completely treatable disease, even to the point that other researchers have seen that we doesn't make a difference how much you cut it away. You make a diagnostic test, you do a first laparoscopy, you do your laser surgery, and they still have inflammation. But this is a good way of following up and keeping them healthy.